All right, well, we will get started. Good afternoon, everyone, and thank you for joining us for the presentation of our findings from OCA's AAPI Digital Access Survey. I'm Tung Nguyen, the Executive Director here at OCA, and I'm really excited to share this space with you today. A little over a year ago, T-Mobile had approached OCA with the opportunity to bring on a fellow for any project related to the digital divide that we wanted to work on. Our immediate priority was data disaggregation and better understanding of connectivity and digital literacy in the Asian American and Pacific Islander community. We know that this is a huge gap of understanding that really needs years of research and a lot of money, but we wanted to take a small step, even if it was just a baby step, with the resources that we did have. Fast forward to today, I'm proud to have our Broadband Access and Digital Equity Fellow, Jeong, give a report out on our survey efforts. Please note that the report will be made available to the public on our website on September 1st, next week. But any additional questions or requests for data can be answered through a direct email inquiry to our team. Before I hand it over to Yen, I just want to recognize the great work that she has done over the past year. Yen has put in countless hours of surveying, interviewing, and most importantly, community building with many of you here today. Yen took this project, which was basically just a planted seed, and nurtured it into a young plant. And we look forward to continuing to grow it in the coming years with everyone else here. Just some quick housekeeping. This webinar is being recorded and will be uploaded to our YouTube channel and website. And there will be time at the end for some Q&A. So with that, I'll turn it over to Yen to begin the presentation. And you can use the Q&A box at the Zoom bar below to submit your questions, and we'll get to them at the very end. Go ahead, Yen.
Thank you too for the warm introduction. Give me a second to figure out the screen sharing part. Can you see the screen too? Okay, thank you. Hello everyone. I am thrilled today to share the results of the AAPI Digital Access Survey. Again, my name is Jeong, and I am the Broadband Access and Digital Equity Fellow at OCA National. Yes, we will, please feel free to click the Q&A icon at the bottom of the screen if you have any questions, and we'll answer those questions at the end of the presentation. Okay. So I'd like to start by introducing the AAPI Digital Access Survey. So OCA developed this survey to understand where and how APIs have internet access, so that we could identify the diverse needs and challenges they faced. We want to advocate for digital equity by listening to our community, because there are severe gaps in our knowledge about the API community, especially when it comes to digital needs. And our survey is different from existing data in that we try to be more inclusive of APIs by, for example, making sure that Pacific Islanders are represented and having the survey available in multiple API languages. Now, I'd like to walk you through the methodology of the survey. It was an anonymous survey conducted nationally, and it was open for 5 months from December 2022 to April 2023. We used the convenient sampling method by sharing our surveys online, and we did this through our 35 plus chapters and affiliates across the country. We'd especially like to thank the 6 partners of the survey project that are mentioned on this slide. And to encourage more people to participate, we also provided an incentive that was a chance to enter a raffle to win a $100 Amazon gift card. In terms of eligibility, anyone self-identifying as of the Asian American and Pacific Islander community, regardless of birthplace or citizenship, 18 years and older, and currently living in the US, was eligible to take the survey. And the survey was available in 12 API languages, as you can see on this slide. Next, these are the types of data that we collected through the survey. First, we asked simple questions to learn about our respondents. So topics included the zip code, age range, ethnic background, gender identity, English proficiency, and household size. And then we asked about their digital accessibility, meaning that we asked what kind of internet subscription they have at home, what kind of digital devices they own, and for what purposes they use their digital devices. Lastly, we had an optional section where participants could provide their contact information. All of our survey responses are anonymous, and the contact information was only used for entering the raffle and reaching out to respondents who agreed to participate in the interviews. And we will also be using this information to share our final report that we will be publishing soon. Our response rate was 73.2%, which is amazing. And we got around 8,300 responses in total. Over 3,600 were English responses and over 4,600 were in-language responses. So we had 1,000 more responses from our translated surveys. Based on our zip code data, 15 states had more than 150 participants. As you can see, they're listed on this slide. And in addition to our surveys, we conducted 3 interviews, and the interviewees were selected from the survey respondents who told us they were interested in getting interviewed. And to show our gratitude for their time and expertise, we provided a $20 Amazon gift card to the interviewees. During the interview, we asked questions to learn more about their survey responses and also their understanding of the digital needs of their own local AAPI community. When we were done with collecting all of the data, we cleaned the data to improve statistical reliability, and we removed spam responses and evident outliers, which resulted in 7,275 responses in total to be used in our data analysis. Now, I'm very excited to dive right into the key findings. So this is the overview of our key findings, and I'll be explaining these in detail in the following slides too. But first, we found that 53.5% of respondents are digitally well connected. And we defined being well connected as owning at least 2 digital devices, as well as having both fixed and mobile internet access at home. Secondly, we found that 76.7% of respondents said that they have fixed broadband services at home. And this is actually a much lower number than the 2016 Pew Research Center's numbers, stating that 84% of Asian Americans have broadband. And third, Southeast Asians had double the percentage of respondents without internet access at home compared to those of East Asians. And next, we noticed that respondents' use of telehealth drastically increased with age. So 50% of respondents who were over the age of 65 said that they were using telehealth or telemedicine services. Lastly, among the respondents, having low English proficiency also meant that they had a higher chance of not having internet at home, as well as a higher chance of owning no digital devices at all. And now I'll explain these findings a little bit more in detail. As I mentioned before, 53.5% of the respondents were digitally well connected, and these are people who have both home internet, so fixed residential internet connection, and an internet subscription on their mobile device. While they're also owning 2 or more digital devices. So it would probably be that their first device would be a smartphone, and a second device they could own a laptop, desktop, or a tablet. But this number also means that 46.5%, which is nearly half of our 8,200 plus API respondents, are not very well connected. Next, we found that 76.7% of the respondents subscribe to a broadband service. According to the FCC, the term broadband commonly refers to high-speed internet access, and we included fiber, cable, DSL, fixed wireless, and satellite subscriptions as broadband. And 95 out of those who said they had a fixed residential internet service had broadband within our respondents. Next, we found differences in digital accessibility by ethnicity groups in our research. And the numbers that I will be highlighting today are in yellow. And if you see the purple chart on the left, it shows the percentage of respondents who don't have internet at home at all by each ethnicity group. So while 1.4% of East Asian respondents mentioned that they don't have internet at home, 3% of Southeast Asian respondents said that they don't have internet at home. And this is more than double the percentage of East Asian respondents. We can see a similar trend on the right brown chart. And this chart displays the percentage of respondents that only have internet connection at home through their phones or tablets. So they have a cellular or mobile connection. And 13.7% of East Asian respondents told us that they have internet connection at home only through their mobile device. However, the same response came from 21.3% of Southeast Asian participants, and that's more than 7 percentage point difference. Moving on, we noticed that telehealth or telemedicine use increases greatly with age. 25%, so 1 out of 4 respondents in the age range 45 to 54 said they use telehealth. That increases to 1 out of 3 in the next age range, so 55 to 64. And if you look at age ranges 65 and over, half of the respondents said they are using telehealth with the digital devices they own. And I believe this shows that having digital access is very, very important to older generations too. Lastly, we found very interesting links between English proficiency and digital accessibility. So the left purple chart shows the percentage of respondents that have no internet connection at all in their homes by English proficiency. And as you can see, 5.4% of the respondents who have no English proficiency said that they don't have internet at home. This percentage shrinks to almost 1/5. So 1.1% when you have native or bilingual level of English proficiency. And if we look at the right brown chart, the difference is much bigger. 4.1% of respondents who have no English proficiency, so that means they don't speak English at all, told us they own no digital devices, so 0 digital devices. But if we look at full professional proficiency and native or bilingual proficiency, that percentage is only 0.1%. So that's 41 times difference. So by looking at these numbers, we could see that if you don't speak English at all, that could be a huge barrier for you to have digital access. Now we would like to share some of the recommendations for future research based on our experiences. So first, we use the convenience sampling method. So doing a survey with a representative sample would be very helpful to have a clearer picture of API digital needs. And even though we had 12 languages available in our survey, we believe that that was not enough, and we encourage future surveys to have more translations. Also, due to limited time and resources, we shared our survey mostly online. But since we want to hear more from those who have lower digital accessibility, we believe for future research should expand to do more outreach in person, especially focusing on locations with insufficient infrastructure and communities with limited English proficiency. Next, we encourage future researchers to conduct a deeper statistical analysis with significant testing to see if the differences are actually meaningful. And lastly, we'd like to recommend that future digital access surveys include questions such as asking people if they know any local or national assistance programs like the ACP, or ask if they're satisfied with the internet services that they're paying for. Also, if the respondent doesn't have internet at home, we could ask, why don't you have internet at home? And lastly, how much people are paying monthly for internet would be great additional data to have, because I think data from these questions would be really helpful to have a better understanding of the API landscape. That was everything I had for today. And before I end my presentation and take questions, OCA would like to thank everyone here supporting our efforts to close the digital divide among API communities. And we are very, very grateful for everyone who took the survey and shared the survey with their connections. And we are especially thankful to these 6 partners mentioned on the slide. Thank you. And now we'll turn to our Q&A session.
Oh, keep your slides up, Yen, just in case someone has to go back to it. But yeah, we'll give it a few minutes. I know folks are probably digesting. If there's a slide you'd want us to go back to, you can drop it in the chat. But we'll give it a few minutes to see if any questions come through.
Yeah, that's totally fine, but I won't be able to see the questions
Oh
with
yeah,
the
I'll read them for you.
Okay,
Yeah.
thank you.
No questions coming in so far. I think it's pretty straightforward. We know, I think if anyone has been following like API wage gap data, this kind of follows along. So I think to the APIs in the audience or advocates in the audience, perhaps some of these trends are not a surprise to you, but really what we wanted to do was prove that Pew Research number wrong, that 98% of Asian Americans are connected to the internet. All right, we have a couple questions coming in. Anonymous, I might have missed this, but is there any analysis of state-by-state API connectivity?
Thank you for the questions. We do have state-by-state API connectivity results. The reason why I didn't share this in our presentation today is because we didn't really see a huge gap by state, but we do have that data. And hopefully I'll try to include more in our actual report. Thank you.
Yeah, if you're curious, we're happy to share the file of data state by state. If you're curious, you can reach out to us. Awesome. Next from Amanda. Thanks for coming by, Amanda. Such exciting research. Did you ask people about how recently they had a medical appointment so you could know whether telehealth usage was more common among people with medical appointments?
We did not. Thank you. First of all, thank you, Amanda. We did not ask if they recently had a medical appointment. Our questions were pretty simple and straightforward. We just asked if they were using telehealth or telemedicine using the devices that they owned. Yes, thank you.
Yeah, the goal of the survey, which Yen and I actually like developed together with some advisory, was to keep it super short and simple, especially for translation into Asian languages, which could make it a little bit more complicated. But that is definitely we're gonna make a note of that to follow up on. Thank you. And then Amanda followed up with, is our definition of well-connected something that we developed on our own, or is it a definition that comes from other research?
This definition we developed on our own, based on our experiences. I personally asked a lot of people, how would you define well-connectedness? Like what level, like how many devices would a well-connected person own? Would you say only having a mobile connection at home would be enough to say you're well-connected? And yes, that was kind of a definition we came together, and I also, of course, asked who we came up with it together. Yeah.
Yeah, it's mostly from like our own community experience, Amanda. So observationally, and I think it worked out. In the report, there will be Yen will have part of the interviews that she did, the in-depth interviews, and perhaps they'll be revealing. Yeah, if it's I would love feedback from other researchers on the definition. And if it picks up, that would be really cool too. But we're open to kind of feedback if that needs to be redefined at all. Anonymous, did any of the data reveal why older APIs use telehealth? You'd think it would be lower.
Thank you for this question. We didn't really ask why. Like Tu mentioned before, our questions were very simple, very straightforward, and this was because we wanted to increase the response rate as high as possible and also make it easier for it to be translated. But we did not ask that question.
Yeah.
Yes, but I think it's very interesting that our data shows it drastically increases with age.
I will say too is something that we didn't collect in hindsight is a question like how did you get this survey? Because we know our partners were sharing the survey and also like giving the survey, conducting the survey on our behalf. The hope also was that our younger OCA members and our younger community members could help their friends and family members take the survey as well. So that could be a factor if you're thinking about an intergenerational household that has youth who are helping their elders use telehealth, that could be a factor why. And so that actually would not be anything we would have found out through any of these questions. So that's also an important note. Want to get to Susan's question. I'm curious if education or income are factored into any of these.
Education and income are not factored in any of our questions, and that was a very we did that intentionally because education and income, any questions related to those information could be sensitive to AAPI communities, and we wanted this survey to be very approachable and very easy to answer without having to worry about any, of their information being overshared or so yes. we do not have any of that included in our survey, even though it would be great if we had that data. Yeah, thank you, Susan.
Yeah, next from Christine. Was there information on connectivity compared to household size? I'm curious on if multifamily households have more or less internet access.
We do have data. I will have to look into the data one more time to see if there was any link to the household size and internet access. Yes, I will look into it because so thank you so much. I did not look into that yet.
Yeah, we have the raw data files. I don't think that was crossed actually. Cross-tabulated. So we'll do that and get, or we can share you, Christine, the raw data. But next from Shirley, I missed the demographic slide. Was there any information collected about immigration status, whether they were first or second gen? I think if you want to go back to the English proficiency slide, that's probably the closest we have. But we did not collect immigration status, first or second gen. Again, just because we really try to keep the survey really simple, to the minimal number of questions. So we actually took that question out, and really relied on English proficiency to sort of signify many of the things here that we are assuming. But again, a really good question that we're going to note down for future research to any of my funders who are on this call. That is a note. Amanda, oh, thank you for your note, Amanda. And Christine, not sure if multi-generational households means more young adults. Kids will tell their people. Yeah, totally agree, Christine. I've also heard a lot of anecdotal stories about folks sharing one computer. So would like to know if that's something that also applies to our communities. I'll tell you right now, like at home, we share one, in my house, we share one computer. And my mom's like, oh, I need to pay the bills or I need to check my email for something, which I run for her. Like we open my computer to do that. So that's definitely like in-depth interviews. We would love to conduct more to get that information. Shirley, thanks. I know it's a tricky question. We're so starved for recent accurate data. I know I think this was also just the purpose of doing it too, as the convenience sampling is not great and super limited questions, and our bandwidth for translations wasn't that wide. But yeah, I think really uncovering the need for more data and exactly where is we have to know what we don't know as well, right? And we were like, we don't know very many things. So exactly where is it that we don't know? Yeah. Oh, back to our Q&A. Was there any data collected on whether people use any digital literacy resources provided by local orgs and municipalities?
I'll take this too. Thank you for answering the questions before. So thank you, Blair, for sharing this question. And we did not ask this question. Like I mentioned before, we highly recommend future research surveys, including questions like this, if they had access, if they even heard of ACP, or if they have had any access to digital literacy resources. We unfortunately did not include those in our survey, but yes, I definitely see the need and the importance of collecting that data. Okay. Maybe we'll wait one more minute for additional questions.
Yeah, we'll definitely be saving this chat and following up with each of you. Oh, so again, the full report will be published on our website, ocanational.org, by September 1st. So you can check back there. We'll have all these slides and additional information. If you would like any of the data, like for your own cross tabulation, we would love to share with you and get your feedback. Or if you have capacity or experience to further cross-tabulate our data, would love to share and continue finding ways to work together on this. And so at that point, you can also reach out to us. So we'll include it all on our website. There's a page for our survey. Awesome. Thank you, Stacy. Well, with that, I think we can begin to wrap up. Thank you, Yen. It's been an incredible journey with you the past year, and we're so grateful to have, honestly, your legacy with OCA now through the survey and report. I did want to share that it is with a heavy heart to say that Yen's fellowship with OCA does end next Thursday. So if you have any questions or follow-up regarding the survey, feel free to reach out directly to me. But Yen still is around through next week, so you can also reach out to her to discuss anything or share information and contact info to keep in touch. The full report will be on our website at ocanational.org. And as we wrap up, I want to acknowledge our partners who have also been doing digital equity work with us for as long as we have and even longer. AT&T, Charter, Comcast, NBC Universal, CTIA, T-Mobile, Verizon, Asian Americans Advancing Justice, AAJC, NCAPA, JACL, NDIA, the FCC, among many others. So thank you to all of our partners, and we look forward to hearing from you as we and working with you as we continue the work of bridging the digital divide. Have a good afternoon, everybody.
Thank you so much for joining.